I would like to ask unanimous consent, since the ranking member, Mr. Pallone, is not here, to yield his time to Representative Kennedy. Without objection, Mr. Kennedy, you're recognized for 5 minutes. Opening statement.
Thank you, Mr. Chairman. I'll take about 30 seconds, I hope. But thank you for yielding and recognizing me. I want to thank the witnesses for their testimony today, and Mr. Whitfield and Mr. Pallone for their work on the NASPA reauthorization. This is an issue that is of particular importance for me back in my home district. At the end of 2014, there were about 209 heroin overdoses in Taunton, Massachusetts alone. In less than 20 days into 2015, there have already been 10 suspected overdoses. We can often trace the origin of those overdoses back to opioid addiction and prescription drug abuse. Tufts Healthcare Institute's program on opioid risk management released a report in 2011 with some alarming findings. They estimated that the societal cost of opioid abuse in the U.S. are substantial, with total societal costs being $55.7 billion and healthcare costs about $25 billion. The annual cost per patient diagnosed with opioid abuse, dependence, and misuse are considerably higher than those with patients without such diagnoses. I was a prosecutor for several years before running for Congress. I saw the effects of opioid addiction every single day in the courtroom through property crimes, breaking and entering, larcenies, and other such crimes that would end up this addiction would drive people to such lengths to break the law to try to continue to feed an addiction. Prescription drug abuse programs and prescription monitoring programs are absolutely critical part to trying to come up with a comprehensive plan to combat this epidemic. And I applaud Mr. Pallone and Mr. Whitfield back for their efforts on this. And I'd like to yield 1 minute of my time back to Mr. Butterfield.